Having discomfort?
Huge pain.
Where?
Talked about it. My bones hurt.
Now, some of that's from the Neupogen. So what I'm trying to say is, these shots that you give yourself, the Neupogen shots,
Yeah.
what they're doing is pumping your bone marrow up. And if you imagine you're a basketball with air in it, and your bone marrow is the basketball, the skin, and then the air inside's the marrow. If you were over pumping that basketball, that would stretch that leather and it would ache. It would ache if you had nerve fibers in that leather. And we're in essence giving you these daily shots, and it's pumping up that marrow inside, air inside the marrow, and it's stretching your marrow, making you have some bone aches. Because you didn't have these aches, is it fair to say, 2 weeks ago before?
No.
They came after we started?
They come after I have the chemo.
So I don't want to, because you're a woman that has no distant spread, remember? I mean, it's just here.
Yeah, so far.
Yeah, I'm saying, and the treatment's shrinking it. The stretching of the ball and of the marrow will decrease with time because your marrow's going to get emptied out a little bit from the chemo. So you won't have this. I don't think you're going to continue to have this pain. You've had 3 cycles so far?
Yeah.
I don't think you're going to continue to have this much discomfort. I would have a low threshold. He's going to write for these patches, and you put them on, and every 3 days you take it off and put a new one on.
Yeah.
But I would challenge you to say you will likely not need to continue these patches. I mean,
Exactly.
And I don't want you to get loopy and this or that. But I mean, I think you can end up probably in a day or so taking the patch off, setting them aside, and then you're having these oxycodone pills that are for, breakthrough pain if you have it.
Right.
That's what I would tend to use. If
Okay.
you're achy, take an oxycodone. I don't know if I'd wear this patch, which provides 24 hours of stuff.
I don't think I said it to her too, that I felt that I didn't want to be addicted to anything that.
You don't need to be.
Yeah.
I mean, and I'm not worried about addiction. I'm just worried about matching the right answer to the right question.
Right.
And Duragesic patch and oxycodone is too much, frankly, for probably what you have. I would think the oxycodone alone, periodically taking a 5 milligram, will handle it.
I feel good like the day before chemo, chemo day, and the chemo day after, and then I feel like heck.
I guess I'm not going to tell them not to write the patches, but I wanted to be clear on these fentanyl patches are really what we put on people who have bone metastases, who are in a different place or time than you.
Okay.
It's a little.
I'm clear with you. I get it.